Let's say it's your first week at your new job as a dental hygienist. You think you have the skills you need to communicate effectively with your coworkers and patients. However, everyone could use some tips and tricks to help them feel even more comfortable. Today I will be talking about essential communication skills for dental hygienists. You may not be going into the dental field like I am, but some of you are going into the medical field, and others of you already are in the workplace. By knowing some essential communication skills that dental hygienists use, you might also be able to incorporate them into your future career or your current workplace. After having many scary first day experiences at job shadows and past jobs, I decided to prepare myself, and hopefully some of you guys, on how to effectively communicate as a dental hygienist. Today I will explain some key principles of verbal and nonverbal communication, the 7 C's of communication, and 4 important rules which all dentist office staff members should remember. There are some important verbal and nonverbal communication skills needed when talking with patients. In September of 2003, an article called Improving Communication Skills by CEO of Professional Dental Management, Diane Glasgow, was published in the Registered Dental Hygienist magazine. The magazine article explained that good communication skills are just as important as good clinical skills for all healthcare professions. There was an example used that estimated that 85% of all malpractice cases are the result of poor communication. How you receive your patient from the reception can set the tone for a great appointment or a bad one. It takes effort to warmly welcome and greet your patient with a smile, but it is worth the effort in order to ensure a great appointment. Along with the verbal skills, Glasgow also mentioned 5 essential nonverbal skills needed for developing an excellent chairside manner: looking, listening, lingering, touching, and identifying. Using these 5 skills can ensure a nonverbal relationship. Now that we have talked about verbal and nonverbal skills, let's talk about the 7 C's of communication. In order to simplify the skills needed to communicate effectively, I'm going to explain the 7 C's of communication. An article posted on Pocket Dentistry called 9 Communication Skills of the Dental Hygienist, written in January 2015 by current registered dental hygienist Marcus Zizo. Mr. Zizo lists the 7 C's of communication that should and can also be used in the dental office. The first C is clear. Make sure it is easy for the patient to understand the meaning of what is being said. Patients should not have to read between the lines to make assumptions about what you are telling them. Number 2 is concise. Stick to the point and make it brief. The patient does not want to stay in the dentist office longer than needed. Number 3 is concrete. The message should include small details and vivid facts so that the patient has a clear picture of what he or she is being told. The 4th C is correct. Make sure there is error-free communication. Number 5 is coherent. Make sure all points are connected and relevant to the main topic and that the tone and flow are consistent. The 6th C is complete. Provide the patient with everything they need to be informed in order to make a decision. The last C is courteous. Communication should be friendly, open, and honest. The patient's viewpoint should always be in mind, and communication should be empathetic to his or her needs. Since we have talked about verbal and nonverbal skills and the 7 C's of communication, let's talk about the 4 important rules which all dental office staff members should remember. There are 4 important rules for sending a message that all dentist office staff should remember when communicating with others, patients, or coworkers. Dr. Muna Taj, a dental surgeon from India, published an article in January 2011 called Health Communication on the website HealthDrip. The article states that these 4 rules: first, know the receiver. Each person has a different background. The communicator must adapt to the listener's needs, expectations, and ability to understand. Second, speak clearly and conscious. The speaker needs to speak clearly and professionally while dealing with patients. It also may be helpful to mirror the speech speed of the person whom you are speaking to. Third, present all information on the receiver's level. Most patients have little, if any, knowledge of dental terminology. So it is important for the staff to take time to explain any technical terms that are being used during treatment discussion. Lastly, obtain feedback. Ask questions to gauge the understanding and effectiveness of your dental communication. The most important elements in the dental communication process are the message, the sender, the receiver, and the feedback. Today I have discussed some important skills for verbal and nonverbal communication, the 7 C's of communication, and the 4 important rules that all dental office staff should remember. Next time you're at work or you are in your first week of a new job, you will know some important communication skills that will help you establish a great workplace communication, whether it be with patients or coworkers. Preparing yourself for first week surprises and conflicts can be very helpful. With these skills, we can now communicate properly and effectively so that we do not start off on a bad foot. If we only knew these skills before we had that first week experience.